Good evening, everyone. The impotence and premature ejaculation are two big problems faced a lot of men and causes a problem in many families. Today we will give a hope to all those men who suffers from the impotence. With us today, Dr. Ala Abdelaziz Ajlan, doctor in the International Center for Cosmetic Surgery and Penis. Welcome, doctor. At first, doctor, the impotence is a big problem. I want you to give an advice to the people who takes a lot of medicines without asking any doctor. Is that could harm them?
Yes, sure. Any medicine is taken without asking a doctor is totally wrong. At first, the person should know if he suffers from impotence or not, because there are a lot of men have misunderstanding about impotence. Before we said that there is impotence, we should have evidences for this. For example, making X-ray scanning for the penis, or when the person complains many times, so we can't confirm that there is an impotence until we make X-ray scanning for the penis to show all the details. And I'm also asking the man if the morning erection is existing, so that's enough to decide that there is no problem. If he having sex most of the time without impotence, so there is no problem. If the person had occasional reason like prostate infections, urinary tract infections, or some worries,
So that's meaning that for all the men not every small problem considered as impotence?
absolutely no. I cannot say that there is impotence without X-ray scanning, or if the man can practice sex without any medicines, so I decide that he is okay. But sometimes there is a person practice sex okay without any problems, and suddenly a problem took place for some worries and physiological reasons. So the person starts to complain and feels down. The problem is that if the person not good physiologically, the brain could interpret that he suffered from impotence. Or sometimes the opposite happens. For example, there is some diseases causes erection, and there is a very rare case, a woman called Anika Borshkov. She had a woman called Anika Borshov. She had gallbladder surgery. During the surgery, an mistake happened for the nerve of the left leg and the vagina. So she complains that when she walks, she feels orgasm. That is the result for the mistake which happened to the nerve, which make the brain interpret that the pressing on the left leg is a pressing on the vagina.
So doctor, now we want to talk about people that we confirmed that they are suffering from the impotence. What is the cure? And also we wanted to talk about the stent of the penis which gives a hope to a lot of men.
We don't do any surgeries as long as there is a response for the medicines. So if the persons take Viagra and it works with, I prefer to not do any surgeries.
Now doctor, we want to talk about the penis stent. Does it really helps and how it works, and it needs local anesthetic or full anesthetic?
For the stent, we can use any type of anesthetic, but everyone should know that the stent shortens the penis about 2.5 to 4 centimeters. There are two types of the stent, the inflatable stent and the semi-flexible stent. The inflatable stent using a hydraulic system, press a button and penis start to erect, and the semi-flexible stent that the person using his hand to erect the penis. I have a surgery carrying my name called Ajlan. This surgery for installation of the stent. I am using the subtunical technique. That technique enables the person to take Viagra and enable him to take it off again. Then we do an enlarging for the penis because as we mentioned before that the stent shorten it about 2.5 to 4 centimeters. So we enlarge the penis to give an extra length or to avoid the loss of the length after the stent. Then we increase the width using injection and we do an operation for the premature ejaculation to increase the duration of sex to get the complete useful from the stent.
And before talking about premature ejaculation, if there are any instructions after the stent,
Installation of the stent takes about 20 minutes and the patient leaves the hospital after 4 hours. He can practice all the daily activities at the same day, like driving the car and taking a shower, but he cannot practice sex before 1 month. The surgery has no side effects.
Now we will move to premature ejaculation. And it is a worldwide problem. If we start talking about the premature ejaculation, what's the definition? And how we can say that this person suffers from premature ejaculation?
There are a lot of different definitions for the premature ejaculation. There is a definition said that it's less than 1 minute. Another one said less than 2 minutes. Another more one said it's less than 3 minutes. For me, I see that the definition of premature ejaculation is that someone reached to orgasm before the other one during the sex. For the woman, 27% reached the orgasm before 1 minute, and 90% reached the orgasm before 7 minutes. So, theoretically, to solve 90% of the problems, I should make the duration before ejaculation 7 minutes. So, if the patient spent 20 seconds to ejaculate, then he took pills, so he maybe spent 200 seconds, about 3 minutes, and that's good, but not very. So, before the operation, I have to diagnose the patient at first to see what we can get. There are some people have increased of the secretions of the brain, and that affects the premature ejaculation somehow. Maybe some people have increased in the activity of the pomper muscle that we called bulbospongiosis. Prostate infections also affect the premature ejaculation. And also some people have very sensitive frontal part of the penis. In the past, that was a very serious problem. But now, we have an easy solution for it. Either inject the head of the penis with filler or using spray. It's very simple. And also we can do our operation with injecting the head of the penis to gain all the benefits, with successful rate up to 97%.
المذيع, tell us more information about this operation, doctor.
This operation is very simple. There is a point under the head of the penis, about 1 centimeter, we called it delta triangle. This point is the most sensitive point of the penis, and it's like the G-spot of the woman. The concentration of the sensory receptors in this point is 18 in 1 millimeter, while the other parts of the penis around 6 to 8. Once we cut this point, we get good improvement. There is another point which is the pomper muscle, or the bulbospongiosis. This muscle is like a belt around the lower part of the penis.
What is this muscle does, doctor?
When the man is going to ejaculate, he feels contractions. Sometimes this muscle has hyperexcitability. That the latest researchers found that when we do massage for prostate, it causes increase of the activity of the muscle, so the premature ejaculation happen. Also, there are pressure receptors in the head. Once you press on the head of the penis, you get a contractions in the pomper muscle. During the sex, the woman's vagina makes contractions on the penis, and that is in turn increase the contractions of the penis, which lead to the premature ejaculation. There are two stages of the ejaculation. The first one is collecting the sperms, and the second one is the ejaculation itself. When we cut the delta spot, we increase the duration of the first stage of collecting the sperms. In Korea, they did an operation like that one, but the successful rate that they achieved just 40%. My operation achieves 97%. And also to avoid the surgery, the patient can use spray on this spot. So now we have success rate of my operation is 97%. What about the other 3%? They have increase of secretion of the brain, so I can give the patient some medicine with the operation to get the best result. We do medical tests for the patient, then it check the sensitivity of the delta spot, the head of the penis, the activity of the muscle, and the secretion of the brain.
What about the result of the operation, doctor?
As we mentioned, when we combine the cut of the delta with the cut of the muscle, it gives success rate up to 96.6%. This operation increased the duration about 200% up to 1000%, and in some rare cases it reaches 2000%.
During the premature ejaculation operation, you are using local anesthetic or full anesthetic. And what is the instruction that you give to the patient after the operation?
Usually we used anesthesia bust. The operation is very easy. It takes about 10 minutes. Very simple. You just cut a piece of skin and a muscle, and the patient leave the hospital before 4 hours. There are no side effects for the operation. The patient can practice all the daily activities, practicing sex after 3 weeks.
Thank you, doctor, for all those great information, and see you next time. Goodbye.